Are you looking for a weight loss solution that works? Meet semaglutide, also known as Ozempic for diabetes and Wegovy for weight loss, is a medication that's been around for a few years. It was initially created for people who have diabetes that was not well controlled. And one of the things we saw, definitely it helped with the diabetes, but also we saw people lose weight, which is awesome for people who have diabetes because it actually can help reverse your diabetes. So they did clinical trials on semaglutide, and ultimately it led to FDA approval for Wegovy, which is specifically approved for weight loss. Ever wonder how a tiny injection can help you lose weight? Let's dive into the science. Well, how semaglutide works is it mimics a hormone called GLP-1. One of the effects GLP-1 is going to have in the body is to slow gastric emptying, which means the time it takes food to exit your stomach. Why this is important, because as we have food in the stomach, we will decrease our appetite, and it will take less food for that to happen. So that is one of the ways it's going to help with weight loss. Another thing it's going to do is directly act on the brain to decrease your appetite. And something else it does, particularly helps for diabetes and blood sugar management, is in response to meals, you're going to increase more insulin, and your blood sugar is going to be less elevated for less time. Why that is important is because the higher it is and the longer it's elevated, there's opportunity for you to store that as fat. Does the semaglutide really work for weight loss? Let's look at the evidence. So there is a tremendous number of studies that had looked at this specific medication for weight loss, and they all came back with similar results in that being on a medication led to people losing anywhere from 13 to 15% of their body weight, which is astounding for a weight loss medication. Now, one of the latest trials, called Step 5, looked at people on semaglutide for 104 weeks, 2 years. What they saw was people sustained that weight loss at 2 years. So those people lost 15% of their body weight over that time period. What's interesting though is in similar trials, that was about what people sustained at 1 year. So it suggests after a year, you're not going to get more weight loss, but sustained weight loss. Another thing about the Step 5 trial is that not everyone got a result. So 93% of people did finish the trial, and 77% of the people lost 5% or more. So what that says is about 23% of people did not sustain 5% body loss or more. How do we use semaglutide? Well, the recommended dosage is to slowly go up over time, and this is really to help minimize the side effects from it. So the first month you would do 0.25 milligrams for 4 weeks. The next month you would do 0.5. The next month 1 milligram. 4 weeks after that you would do 1.7, and then the top dose is 2.4 milligrams per week. This is a shot that you do under the skin. Uses a very tiny needle, so it's not painful at all. You're increasing this dosage based on the side effect profile. The most common side effects with semaglutide are GI related because it is slowing down your gut. So this includes constipation. You can have nausea. That's probably the most common side effect if people are going to have side effects. You can have a heartburn or reflux because it is delaying how quickly food moves out of your stomach. Interestingly, some people have diarrhea. Other side effects can include headache or fatigue. About 10% of people will get that as well. Most of these symptoms resolve over time, but safety first. What do you need to know before you starting this medication? Well, there are some precautions you want to look at. So one is, probably the biggest, is if you've had a history of thyroid cancer, but particularly medullary thyroid cancer, you should not be on this medication. If there's a family history of medullary thyroid cancer or something called MAN, this is a rare syndrome of cancers, and if you've had that before, then you don't want to be in this medication, or if there's a family history of it. It's one of the biggest contraindications. The other would be pregnancy or breastfeeding, because we don't know how it will impact the fetus or the newborn. But also, if you're pregnant, we're not really trying to lose weight either. Some other things, but not absolute contraindications, but definitely things that we want to be cautious of, is if you had a history of pancreatitis, you definitely want to talk to your provider about that. Also, if you had a history of any significant GI problems, so irritable bowel syndrome, inflammatory bowel syndrome, whether it's Crohn's or ulcerative colitis, definitely want to talk to your provider about that. If you have a history of gastroparesis, definitely want to talk to your provider about that, because this is going to slow your gut down, so it could exacerbate those symptoms. Those are some of the basics of semaglutide. If you're ready to make an informed decision about it, remember this should be used as part of a comprehensive program. You definitely want to be aware of those side effects, including nausea, vomiting, diarrhea, constipation, reflux. The studies have shown now it is quite effective for weight loss over an extended period of time. Most people get a good result, but not 100% by any means. If you are considering semaglutide or have tried it, let us know below. Otherwise, check out one of these videos on weight loss.